You can imagine with the name Bacon, I've been taking this in real well. But thanks, Mr. Chairman, for the time, and I thank each of you for being here. I was raised on a family farm, still an extended family, corn, soybeans. We had about 50 head of cattle. So it was a good childhood for learning work ethic and prepared me well for 30 years in the Air Force to follow. So I wanted to talk a little bit about bilateral trade and also health care. I'll start off with the health care because I don't think we've talked much about it today. In Nebraska, we had a 51% increase in premiums this past year. It falls most heavily on self-employed, small business, and of course we're talking about the family farmer who's having to pay for their own premiums. And we've had a 45% to 50% drop in prices, land values going down, throw in a 51% cost in premiums. Could you talk about how ACA has impacted you in your income and expenses? And do you have any feedback on the bill we're getting ready to vote on today? We'll start off with Dr. Lawrence, or we'll go down the line. Thank you.
I'm not in that situation,
Okay.
right? I have a benefit package through university, so I don't think it's fair for me to comment.
Okay, thank you, sir. Mr. White.
My health insurance for my family this year went up over 100%.
100%.
100%.
You're probably asking for relief, aren't you?
Well, it would be nice because it does. You know, we talk about people not having insurance, and that is you're not supposed to do that. You're supposed to have insurance, but you know it does come to a time that the economics of things make you do things that you don't that maybe you can't do. And we have to have health coverage, and I mean I understand that is vital, especially in farming. I have been injured. I know what it means to be. I know what a big hospital bill is. So it is an issue that we have to take care of. On today's vote, I really couldn't give you an opinion one way or the other than give our state an opportunity to have some competitive bidding on insurance.
Right, and we voted on that yesterday out of the House. Would tax credits help you when you buy your own insurance?
Sure it would.
Okay, that's in this bill. How about expanded HSA where you get tax deductions? Would that help you?
I currently use HSA.
Okay, thank you. That's answering the question that way. Ms. Rickelman.
I don't think I've ever thought about insurance till I was pregnant. I'm 20 weeks pregnant. But yes, I buy my own insurance through Farm Bureau. So does my husband. And the vote would be very, very helpful. We have a health savings account, but as the delivery comes, there's bills and things that we need to pay for, and it definitely weighs heavy on our minds.
If you don't mind me asking, if you feel comfortable, what's your deductible? Because I find people with their deductible so high, they pay every cent of their delivery of their child. Is that, you're in that boat?
Yes.
See, that's not right. Mr. Connor.
Congressman, you know, the healthcare challenges for rural America are, you know, everything that all of our urban counterparts face and then some. And you know, I can't advise you, you know, on today's vote. I will tell you that farmer-owned co-ops do believe that one of the, you know, the things that hinders co-ops from you know getting into this space of providing health care for their members is, you know, the fact that there are the state line limitations, and that, you know, that's, I know, something that's been part of that debate. But let me just say as well that you know, a big issue for rural health care is equally as much as just access to the doctors themselves. Programs like and I'm outside of my expertise space here a little bit, but I know programs like, you know, the J1 program for, you know, bringing doctors to the rural areas, because in some cases at any cost there just simply aren't doctors available, and that's as fundamental as the whole health care.
We've been hearing the same thing in rural Nebraska as well.
Tough.
I think the current ACA bills probably hurt the family farmer as much as anybody, and I think we got to work hard to get relief now. And the HSAs and the tax credits for buying your own insurance will have a huge impact. I don't have a whole lot of time left, but on bilateral trade, you know, Nebraska's a huge export state. Is there any advice, if you guys got more insight versus another one, are there particular countries we should be looking at more? How would you advise the administration to prioritize on this bilateral trade work that we need to be doing?
Well, obviously, don't screw up what you've got, right? Go where the money is and the markets are. China continues to be a growing market, so how do we continue to tap into that one while maintaining our Canada and Mexico, our two large trading partners, Japan, and open up more countries?
Thank you.
And to add to that, from the aspect from the cattle industry, 96% of the population is outside our borders, and a majority, we see a premium of about $300 per fed steer to the cuts that are less, let's say, less desirable in the United States that other countries think are premium cuts. And so anything we can do to level the playing field where we can get our product out of this country and help us move product would be a benefit for us.
I would just say, Congressman, Japan.
Japan.
Would be a huge one. And, if we are indeed in an era of bilateral trade agreements versus multilateral, my advice to him is get to it.
Yep. As I yield back, I'll just say Japan has, I think, a 40% tariff on cattle, so we got to work on that. Sir, thank you, Chairman. Yield back.